The emergency room at St. Mary's Hospital buzzed with its usual chaos. Ambulance sirens wailed outside as another convoy of wounded soldiers arrived from the nearby military base. Sarah Mitchell moved quickly between the gurneys, her blue scrubs already stained with blood and sweat despite the early hour. "Nurse Mitchell, we need you in Trauma Bay 3, called Dr. Harrison, the head surgeon whose reputation preceded him like a thunderstorm. His voice carried the authority of someone who had spent 20 years saving lives and twice as long, reminding everyone of it. Sarah rushed to the trauma bay where a young soldier lay unconscious, his uniform torn and dirty. His breathing was shallow and a deep gash ran across his forehead. She immediately began checking his vital signs while preparing the IV line. "His blood pressure is dropping fast," she reported to Dr. Harrison as he entered the room, his surgical team trailing behind him like devoted disciples. Dr. Harrison barely glanced at the readings Sarah had carefully documented. "I can see that," he said dismissively. "Just keep him stable while we prep for surgery." "That's what nurses do." Sarah bit her tongue. She had learned long ago that challenging Dr. Harrison in front of others only made things worse. Instead, she focused on the patient, noticing something the doctor had missed. The soldier's pupils were responding normally to light, which seemed odd given his other symptoms. As the surgical team wheeled the patient away, Sarah found herself alone with her thoughts. She had been working at St. Mary's for 3 years now, ever since she graduated from nursing school. Every day brought new challenges, new patients to care for, and unfortunately, new reminders of how some people viewed her profession. The hospital cafeteria was nearly empty when Sarah finally took her break. She sat alone, picking at a sandwich she had no appetite for. Her mind kept returning to the young soldier, and something that nagged at her about his condition. "Rough morning?" asked Jennifer, another nurse who had become Sarah's closest friend at the hospital. Dr. Harrison was being his usual charming self, Sarah replied with a tired smile. "Sometimes I wonder if he even sees us as real people." Jennifer sat down across from her. "You know, I heard he's being considered for department head." "Can you imagine?" Sarah shuddered at the thought. Dr. Harrison already treated the nursing staff like they were invisible most of the time. More power would only make things worse. The conversation was interrupted by an announcement over the hospital's PA system. "Code blue in the ICU, code blue in the ICU." Both women immediately abandoned their lunch and ran toward the intensive care unit. The young soldier from that morning was in cardiac arrest. Dr. Harrison stood at the foot of the bed, barking orders at the medical team. "He's not responding to the defibrillator," one of the residents reported. Sarah watched the monitor, her trained eye catching something in the rhythm that others seemed to miss. Without thinking, she stepped forward. "Doctor, his heart rhythm suggests—" "Not now, nurse," Dr. Harrison cut her off without looking up. "We're handling this." But Sarah could see they weren't handling it correctly. The soldier's condition was deteriorating rapidly, and she had a strong suspicion about what was really wrong. She had seen similar cases during her training, but Dr. Harrison was too focused on the obvious symptoms to consider other possibilities. 20 minutes later, they lost him. The room fell silent except for the steady beep of the flatlined monitor. Dr. Harrison stepped back, his face grim but unsurprised. "Time of death 1437, he announced to the room. Sarah felt her heart sink. She stared at the young man's peaceful face and couldn't shake the feeling that his death could have been prevented. But who was she to question someone with Dr. Harrison's experience and credentials? Later that evening, Sarah found herself in the hospital's medical library. She couldn't get the case out of her mind, so she decided to research similar symptoms and conditions. The library was quiet, with only the soft hum of fluorescent lights and the occasional turning of pages. As she read through medical journals and case studies, her suspicions were confirmed. The young soldier's symptoms had pointed to a rare but treatable condition that Dr. Harrison's team had completely overlooked. If they had caught it in time, he would have survived. Sarah closed the journal she was reading and leaned back in her chair. She felt a mix of anger and sadness wash over her. A young man had died, and she might have been able to save him if anyone had listened to her. The next morning brought another wave of casualties from a training accident at the military base. Sarah threw herself into her work, trying to push away the thoughts of the previous day. She moved efficiently from patient to patient, checking vitals, administering medications, and providing comfort to those who were scared and in pain. "Sarah, we need you in Trauma Bay 1, called Dr. Peterson, one of the younger surgeons who actually treated the nurses with respect. This time, the patient was an older soldier, probably in his 40s, with multiple injuries from what looked like an explosion. As Sarah began her assessment, she noticed his dog tags and military insignia. He was a sergeant, someone with years of experience and likely many stories to tell. "What's his status?" Dr. Peterson asked as he entered the room. "Multiple contusions, possible internal bleeding, but he's stable for now," Sarah reported. "His blood work shows some irregularities that we should monitor closely." Dr. Peterson nodded and actually looked at the readings Sarah had prepared. "Good catch. Let's get him to surgery immediately." As they prepared to move the patient, his eyes fluttered open for a moment. He looked directly at Sarah, and something in his gaze made her pause. It was as if he was trying to tell her something important. "Ma'am," he whispered, his voice barely audible. "Are you Sarah Mitchell?" Sarah was surprised that he knew her name. "Yes, I am. Don't try to talk right now. You need to save your strength." But the sergeant gripped her hand weakly. "I need to tell you something," he said. "About yesterday, about the soldier who died." Sarah's heart began to race. How could this man possibly know about what had happened the day before? "I don't understand," she said gently. The sergeant's eyes were growing heavy from the medication, but he fought to stay conscious. "He was my son," he whispered. "And you tried to save him." Sarah's hands trembled as she stared at the wounded sergeant. The weight of his words hit her like a physical blow. The young soldier who had died the day before was this man's son. Her throat felt tight as she struggled to find the right words. "I'm so sorry for your loss," she whispered, her professional composure barely holding together. Sergeant Williams squeezed her hand with what little strength he had left. "You don't understand," he said, his voice growing weaker. "I know what you tried to do. I know you saw what the others missed." Before Sarah could respond, Dr. Peterson returned with the surgical team. "We need to get him upstairs immediately," he announced, and the conversation was cut short as they wheeled the sergeant away. Sarah stood alone in the empty trauma bay, her mind racing. How could he possibly know what had happened? She had been careful not to discuss her suspicions with anyone, especially after Dr. Harrison had dismissed her so coldly. The rest of her shift passed in a blur. Every time she tried to focus on her other patients, her thoughts returned to Sergeant Williams and his son. When her replacement finally arrived that evening, Sarah found herself walking to the ICU instead of heading home. The sergeant was awake when she quietly entered his room. Bandages covered most of his torso, and various machines monitored his vital signs. Despite his injuries, his eyes were alert and focused when he saw her. "I was hoping you'd come," he said softly. Sarah pulled a chair closer to his bed. "How did you know about yesterday? About your son?" Sergeant Williams was quiet for a long moment, staring at the ceiling. "My boy called me 2 days ago," he finally said. He was nervous about some training exercises they had planned. "We talked for over an hour." He turned to look at Sarah directly. "He told me about a nurse at the hospital who had helped him before. Said her name was Sarah, and that she really cared about the soldiers they brought in. He said she was different from the others." Sarah felt her eyes begin to water. "When was he here before?" 3 weeks ago. Minor injuries from a fall during training. He said you stayed with him when he was scared, talked to him about his hometown. Made him feel less alone." Sarah remembered now. A young private who had been homesick and worried about calling his girlfriend. She had sat with him for a few minutes during her break. Nothing more than basic human kindness. "He respected you," the sergeant continued. "Said you knew things that even some of the doctors didn't notice. That's why I had to tell you something." Sarah leaned forward, unsure if she wanted to hear what came next. "I was in the hallway yesterday when they brought him in from surgery," Sergeant Williams said. "I heard Dr. Harrison talking to his team. Heard him say that the death was unavoidable, that they had done everything possible." The sergeant's jaw tightened with anger despite his pain. "But I also heard one of the residents mention something about a nurse who had tried to suggest a different diagnosis. Said Dr. Harrison shut her down." Sarah felt her cheeks flush. "I should have pushed harder," she said quietly. "I should have made him listen." "No," Sergeant Williams said firmly. "You did your job. You tried to help. It's not your fault that ego got in the way of medicine." They sat in silence for several minutes. Finally, the sergeant spoke again. There's something else you need to know about my son. About who he was. Sarah waited, sensing that whatever came next would be important. Private Williams wasn't just any soldier, the sergeant said with pride in his voice. He was studying to become a combat medic. Wanted to save lives on the battlefield. Just like you save lives. Here, the irony wasn't lost on Sarah, a young man who wanted to heal. Others had died because his own healers wouldn't. Listen to someone trying to help. He wrote letters, the sergeant continued. Dozens of them. To wounded soldiers he had visited in hospitals. To families of soldiers who hadn't made it home. He believed that everyone deserved to be heard, to be valued. Sarah wiped away a tear that had escaped down her cheek. He sounds like an amazing young man. He was, and he would want me to tell you something else. The sergeant reached under his pillow and pulled out a folded piece of paper. I found this in his belongings. It's addressed to you. With shaking hands, Sarah unfolded the letter. The handwriting was neat and careful, the words of someone who had taken time to think about what he wanted to say. Dear Nurse Sarah, it began. I hope I never have to give you this letter, because it means something bad has happened to me. But if you're reading it, I want you to know how much your kindness meant to me when I was scared and alone. You made me believe that there are still people in the world who truly care about others. Sarah had to pause in her reading as more tears blurred her vision. The letter continued. I've been watching how some people treat nurses at the hospital. I've seen how doctors sometimes dismiss your knowledge and experience. I want you to know that real soldiers understand the value of every person on the team. We know that medics save as many lives as surgeons do, sometimes more. Please don't let anyone make you feel like you're just a nurse. You're a healer, a comforter, and a guardian of hope. The world needs more people like you. The letter was signed simply, with respect and gratitude, Private Daniel Williams. Sarah carefully folded the letter and held it against her chest. She looked up to find Sergeant Williams watching her with sad but determined eyes. My son saw something in you that others miss, he said. He saw strength and wisdom that goes beyond job titles and degrees. That's why I need to ask you for something. Sarah nodded, not trusting her voice to remain steady. Don't let his death be meaningless, the sergeant said. Don't let Dr. Harrison's attitude keep you from speaking up when you know you're right. My boy believed that every voice matters, especially when it's trying to save a life. Sarah thought about all the times she had stayed quiet, all the moments when she had second-guessed herself because someone with more credentials had dismissed her concerns. How many other patients might have suffered because she hadn't been brave enough to insist on being heard? I don't know if I'm strong enough, she admitted. Sergeant Williams smiled for the first time since she had entered his room. My son didn't think he was strong enough to be a medic when he first enlisted. But strength isn't about never being afraid. It's about doing what's right even when you are afraid. As visiting hours ended and Sarah prepared to leave, the sergeant called out to her one last time. Nurse Sarah, he said, using the same respectful tone his son had written about. Promise me you'll remember what I told you. Promise me you won't let them silence you again. Sarah looked back at him from the doorway. I promise, she said, and for the first time in her career she truly meant it. The next morning arrived with an unusual heaviness in the air. Sarah had barely slept, her mind replaying the conversation with Sergeant Williams and reading his son's letter over and over. She folded the letter carefully and placed it in her pocket before heading to work, drawing strength from its presence. The emergency room was quieter than usual when Sarah arrived for her shift. Dr. Harrison stood near the nurse's station, reviewing charts with his typical air of superiority. Sarah felt her stomach tighten as she approached to receive her patient assignments. Nurse Mitchell, Dr. Harrison said without looking up from his paperwork, you're assigned to monitoring duties today. Keep an eye on the post-surgical patients and update their charts. Sarah nodded, understanding that this was probably Dr. Harrison's way of keeping her away from active cases. But she didn't argue. Instead, she began her rounds, checking on patients with the same care and attention she always provided. In room 204, she found Mrs. Chen, an elderly woman recovering from gallbladder surgery. The woman was awake but seemed restless and uncomfortable. How are you feeling this morning, Mrs. Chen? Sarah asked gently, checking the woman's IV line and surgical dressing. Something doesn't feel right, Mrs. Chen whispered. The pain is different than yesterday, sharper. Sarah immediately began a more thorough assessment. Mrs. Chen's vital signs showed a slight elevation in heart rate and blood pressure. Her surgical site looked normal, but Sarah noticed the woman was holding her right shoulder in an unusual way. "Can you describe the pain for me?" Sarah asked, already suspecting what might be happening. "It's here," Mrs. Chen said, pointing to her right shoulder and upper abdomen. "It feels like gas, but much worse." Sarah's training kicked in. These symptoms could indicate a serious post-surgical complication that needed immediate attention. She quickly documented her findings and went to find Dr. Harrison. She found him in the break room, drinking coffee and discussing golf with one of the residents. Sarah knocked politely on the doorframe. "Dr. Harrison, I need to speak with you about Mrs. Chen in room 204. He looked up with obvious irritation. "What about her?" "She had routine surgery yesterday. Everything went fine. She's experiencing right shoulder pain and elevated vital signs. I think she might be developing a post-operative complication that needs immediate evaluation." Dr. Harrison set down his coffee cup with an exaggerated sigh. "Nurse Mitchell, Mrs. Chen is fine. Post-surgical patients always complain about pain. That's why we have pain medication." "But doctor, the pattern of her symptoms suggests—" "I don't have time for this," Dr. Harrison interrupted. "Give her another dose of pain medication and stop bothering me with routine nursing concerns." Sarah felt her face flush with frustration. She thought about Private Williams' letter in her pocket and Sergeant Williams' words about not letting his son's death be meaningless. "With all due respect, doctor, I think this could be serious. Her symptoms are consistent with internal bleeding or bile leakage." The room fell silent. The resident looked uncomfortable and Dr. Harrison's expression darkened. "Nurse Mitchell," he said, his voice dangerously quiet. "Are you questioning my medical judgment?" Sarah's heart pounded, but she forced herself to stand her ground. "I'm reporting concerning symptoms that warrant further investigation." Dr. Harrison stood up slowly, his imposing figure casting a shadow over Sarah. "Let me remind you of something. I am the surgeon. I performed Mrs. Chen's operation. I know her condition better than anyone in this hospital. But if we could just run some blood work—" "Enough." Dr. Harrison's voice echoed through the break room. "You are a nurse. Your job is to follow orders, not to diagnose patients. If you can't understand that basic concept, perhaps you should consider a different career." Sarah felt every eye in the room on her. The resident looked away, clearly uncomfortable but unwilling to intervene. She could feel her confidence wavering under Dr. Harrison's intense glare. But then she thought about Private Williams, about his belief that every voice mattered when it came to saving lives. She thought about his father's promise and the weight of responsibility she carried. "I understand my role, doctor," Sarah said, her voice steadier than she felt. "But I also understand my responsibility to advocate for patient safety. I'm going to document my concerns in Mrs. Chen's chart." Dr. Harrison's face turned red with anger. "You do that," he said sarcastically. "And while you're at it, document that I examined the patient and found no cause for concern." Sarah left the break room feeling shaken but determined. She returned to Mrs. Chen's room and found the woman's condition had worsened. Her pain had intensified and she was becoming pale and clammy. "Please," Mrs. Chen whispered, gripping Sarah's hand. "Something is really wrong." Sarah made a decision that could cost her job. She called Dr. Peterson, the younger surgeon who had treated Sergeant Williams with respect. When he arrived, she quickly explained her concerns. Dr. Peterson listened carefully and immediately ordered blood work and imaging studies. Within an hour, they had their answer. Mrs. Chen was indeed experiencing internal bleeding from a small tear in her liver that had been missed during surgery. "You saved her life," Dr. Peterson told Sarah as they watched Mrs. Chen being prepped for emergency surgery. "If we had waited any longer, she could have bled out internally." But Sarah's relief was short-lived. Dr. Harrison appeared in the hallway, his face thunderous with rage. "Nurse Mitchell," he called out loudly enough for everyone to hear, "report to my office immediately." As Sarah followed him down the hallway, she could feel the stares of other staff members. Some looked sympathetic, others curious, and a few seemed almost afraid. Dr. Harrison's office was sterile and cold, filled with diplomas and awards that seemed to stare down at Sarah from every wall. He closed the door and moved to stand behind his desk like a judge preparing to deliver a sentence. "What you did today was insubordination," he began, his voice controlled, but seething with anger. "You went behind my back, questioned my judgment, and undermined my authority in front of the entire medical team. Sarah remained standing, her hands clasped behind her back. I followed proper protocol for patient advocacy. You followed nothing but your own arrogance, Dr. Harrison shot back. Yes, Mrs. Chen needed surgery, but that doesn't vindicate your behavior. You should have trusted my experience and judgment. Your experience almost cost a woman her life, Sarah said quietly. The words hung in the air like an accusation. Dr. Harrison's eyes narrowed to dangerous slits. How dare you, he whispered. I have been practicing medicine since before you were born. I have saved more lives than you will ever see in your entire career. And I respect that, Sarah replied. But being experienced doesn't mean being infallible. Even the best doctors make mistakes. Dr. Harrison leaned forward across his desk. Let me make something very clear to you, Nurse Mitchell. This hospital runs on hierarchy and respect. When that breaks down, people die. Your little act of rebellion today could have set a dangerous precedent. Sarah thought about Private Williams and his father. She thought about Mrs. Chen, who was alive because someone had listened to concerns that mattered. Maybe the dangerous precedent is silencing people who are trying to help, she said. For a moment, Dr. Harrison looked genuinely shocked that she had spoken back to him again. Then his expression hardened into something cold and calculating. You're suspended, he said simply. 3 days without pay. Use that time to think about whether you really belong in this profession. As Sarah walked toward the door, Dr. Harrison called out one last comment. And Nurse Mitchell, don't think this is over. I'll be watching every move you make from now on. Sarah's 3 days of suspension felt like 3 weeks. She spent the time walking through parks, reading medical journals, and trying to decide if she had made the right choice. The letter from Private Williams never left her pocket, and she found herself reading it whenever doubt crept into her mind. On her second day off, she received an unexpected visitor. Jennifer knocked on her apartment door, carrying a bag of groceries and wearing a worried expression. I brought dinner, Jennifer announced, pushing past Sarah into the small living room. And I brought news from the hospital. Sarah helped her friend unpack the groceries, grateful for the company. How bad is it? Is everyone talking about what happened? Jennifer paused in arranging items on the counter. Actually, it's not what you might expect. Dr. Peterson has been telling everyone how your quick thinking saved Mrs. Chen's life. Some of the other nurses are calling you a hero. And Dr. Harrison? Still furious, but he's been quieter than usual. I think he knows that what happened with Mrs. Chen makes him look bad. Jennifer turned to face Sarah directly. There's something else. Sergeant Williams has been asking about you. Sarah's heart jumped. Is he okay? How is his recovery going? He's doing well considering his injuries. But he's been telling stories about you to anyone who will listen. Sarah, he's not just any soldier. What do you mean? Jennifer sat down heavily on the couch. I did some research after you told me about him. Sergeant Williams is a decorated war veteran. He served 3 tours in Afghanistan and received multiple medals for bravery. But more importantly, he used to train combat medics. Sarah joined her friend on the couch, sensing there was more to the story. He's been talking to some of the doctors about military medicine and how medics work in the field, Jennifer continued. Apparently, he's been making some interesting comparisons between battlefield medicine and hospital politics. What kind of comparisons? He told Dr. Peterson that in combat, listening to everyone on your team can mean the difference between life and death. Said that the best officers are the ones who respect input from all ranks because good information can come from anywhere. Sarah felt a warmth spread through her chest. Even while recovering from his own injuries, Sergeant Williams was still fighting for her, still honoring his son's memory. Jennifer reached into her purse and pulled out an envelope. He asked me to give you this. Sarah opened the envelope carefully. Inside was a short note written in the same neat handwriting she had seen in his son's letter. Dear Nurse Sarah, it read, I heard about what happened with Mrs. Chen. My son would be proud of you for standing up for what was right. I have a request to make when you return to work. Please come see me. There are some people I would like you to meet. The note was signed. With respect, Sergeant First Class Robert Williams, U.S. Army, retired. When Sarah returned to work on Thursday morning, the atmosphere in the hospital felt different. She couldn't quite put her finger on it, but there seemed to be an undercurrent of tension mixed with anticipation. Dr. Harrison was nowhere to be seen when Sarah checked in for her shift. Dr. Peterson approached her near the nurses' station, a genuine smile on his face. "Welcome back. Sarah, I'm glad you're here." "Thank you, Dr. Peterson. How is Mrs. Chen doing?" "She's recovering beautifully, thanks to you. She's been asking about you every day." He paused and lowered his voice. "There's something else. We have some visitors today. Military personnel. They're here to see Sergeant Williams, but they've also asked to meet you." Sarah felt a flutter of nervousness. "Military personnel?" "A colonel and a captain from the base medical unit. Apparently, Sergeant Williams has been talking to them about hospital procedures and patient advocacy." Dr. Peterson smiled knowingly. "I have a feeling this could be interesting." Sarah made her way to Sergeant Williams' room, her heart beating faster with each step. When she knocked on the door, she heard his familiar voice call for her to enter. Sergeant Williams was sitting up in bed, looking much stronger than when she had last seen him. Two military officers in dress uniforms stood near the window. They turned when Sarah entered, and she was surprised to see that one of them was a woman. "Nurse Mitchell," Sergeant Williams said with a broad smile. "I'd like you to meet Colonel Patricia Hayes and Captain Michael Rodriguez from the base medical unit." The colonel stepped forward and extended her hand. "Nurse Mitchell, it's a pleasure to meet you. Sergeant Williams has been telling us about your excellent care." Sarah shook hands with both officers, still unsure why they wanted to meet her. "Sergeant Williams has been sharing some interesting perspectives about medical teamwork," Captain Rodriguez said. "As medical officers, we're always looking for ways to improve patient care and communication." Colonel Hayes nodded. "In military medicine, we've learned that the best outcomes happen when every member of the medical team feels empowered to speak up about patient safety. We understand that civilian hospitals sometimes operate differently." Sarah glanced at Sergeant Williams, who was watching the conversation with obvious satisfaction. "We've heard about some recent incidents," the colonel continued carefully, "situations where valuable nursing observations may not have received the attention they deserved." "I'm not sure I understand," Sarah said. Though she was beginning to suspect where this conversation was heading, Sergeant Williams cleared his throat. "Colonel Hayes is the chief medical officer for the entire base. She's responsible for the medical care of over 10,000 military personnel. And we've been discussing the possibility of a partnership program," Colonel Hayes said, "a cross-training initiative between the base medical facility and St. Mary's Hospital." Captain Rodriguez stepped forward. "The idea would be to have civilian medical staff spend time with military medical units and vice versa, learning different approaches to patient care and team communication." "It sounds like an interesting program," Sarah said, still not sure how this related to her. Colonel Hayes smiled. "Sergeant Williams has specifically recommended you as someone who would be valuable in developing this program. He believes your clinical skills and patient advocacy make you an ideal candidate to help bridge the gap between military and civilian medicine." Sarah felt her mouth fall open slightly. "He recommended me?" "More than that," Sergeant Williams said. "I told them about your son." His voice grew serious. "I told them about a young man who believed that every voice matters when it comes to saving lives. And I told them about a nurse who honored that belief, even when it was difficult." Colonel Hayes nodded solemnly. "We're sorry for your loss, Sergeant. And we're impressed by Nurse Mitchell's dedication to patient advocacy. We'd like to offer you a position as a liaison coordinator, Captain," Rodriguez said to Sarah. "You would help develop protocols for communication and patient safety that could benefit both military and civilian medical facilities." Sarah's head was spinning. "I don't know what to say. This is completely unexpected." "Say you'll think about it," Sergeant Williams said gently. "My son believed that good people should be given opportunities to make a real difference." Before Sarah could respond, there was a commotion in the hallway. Dr. Harrison's voice could be heard approaching, and he didn't sound happy. "Where is she?" They heard him demanding. "I want to know why there are military officers in my hospital talking to my nurses." The door burst open and Dr. Harrison strode in, his face red with anger. He stopped short when he saw the two officers in their dress uniforms. "Dr. Harrison," Colonel Hayes said calmly, "we were just discussing a potential partnership program with your nursing staff." Dr. Harrison's eyes moved from the officers to Sarah, and his expression darkened further. "Nurse Mitchell is currently under disciplinary review. I don't think she's the appropriate representative for any partnership programs." The silence in the room was deafening. Sarah felt her cheeks burn with embarrassment, but then she saw Sergeant Williams's face. His expression had changed completely, and for the first time since she had known him, he looked truly angry. The tension in the room was thick enough to cut with a scalpel. Dr. Harrison stood in the doorway, his authority filling the space while the two military officers maintained their professional composure. Sarah felt caught between two worlds, unsure of her place in either. Sergeant Williams slowly sat up straighter in his hospital bed, and when he spoke, his voice carried the unmistakable tone of command that comes from years of military leadership. "Dr. Harrison," he said, each word measured and deliberate, "I think there's been a misunderstanding." "I don't think so," Dr. Harrison replied dismissively. "This nurse has been insubordinate and—" "Doctor," Sergeant Williams interrupted, and something in his voice made everyone in the room pay attention. "Before you say another word, I think you should know exactly who you're talking about." Colonel Hayes and Captain Rodriguez exchanged glances, clearly sensing that something significant was about to happen. "You see," Sergeant Williams continued, his eyes never leaving Dr. Harrison's face, "you keep calling Sarah just a nurse, but you don't know her story." Sarah felt her stomach drop. She had never told anyone at the hospital about her background, preferring to let her work speak for itself. "Sergeant Williams," she said quietly, "you don't need to—" "Yes, I do," he said firmly. Then he looked directly at Dr. Harrison. "Doctor, meet Captain Sarah Mitchell, former United States Army Nurse Corps, veteran of 2 deployments to Afghanistan." The room fell completely silent. Sarah felt every eye turned to her, and she saw Dr. Harrison's confident expression falter for the first time since she had known him. "That's right," Sergeant Williams continued. "The woman you've been treating like an inexperienced subordinate is actually a decorated military officer who has performed surgery in field hospitals under enemy fire." Colonel Hayes stepped forward, a new understanding dawning on her face. "Captain Mitchell, I should have recognized the name. You served with the 47th Combat Support Hospital." Sarah nodded reluctantly, uncomfortable with the attention but unable to deny the truth. "Yes, ma'am." "You were there during the siege of Forward Operating Base Chapman," Captain Rodriguez said, his voice filled with respect. "I heard about that operation." Dr. Harrison looked confused and increasingly uncomfortable. "I don't understand. If you're military, why are you working as a civilian nurse?" Sarah had hoped to never have to explain this story, but she could see there was no avoiding it now. "I left the Army after my 2nd deployment," she said quietly. "She left," Sergeant Williams said, "because she was wounded while saving the lives of 3 soldiers during a mortar attack. She was awarded the Bronze Star for valor." Sarah's hand unconsciously moved to her left shoulder, where shrapnel scars remained hidden beneath her scrubs. "That's enough," she said softly. But Sergeant Williams wasn't finished. She could have stayed in the military and been promoted to major. Instead, she chose to come home and continue serving by taking care of people in civilian hospitals. Colonel Hayes looked at Sarah with new respect. "Captain, why didn't you tell us about your service record when we offered you the liaison position?" "Because it shouldn't matter," Sarah replied. "My military service doesn't make my nursing skills any more valuable. I've worked alongside civilian nurses who are just as skilled and dedicated as any military medic." Dr. Harrison was struggling to process this new information. "Why didn't you tell me you were a veteran?" Sarah looked at him directly. "Would it have changed how you treated me? Should my worth as a medical professional depend on my military rank, rather than my clinical competence?" The question hung in the air unanswered. Dr. Harrison shifted uncomfortably, clearly realizing that his treatment of Sarah now looked even worse in light of her military background. "The point is," Sergeant Williams said, his voice softer now but still firm, "you've been dismissing the medical opinions of someone who has saved lives under conditions you can't imagine. Someone who has made life-and-death decisions when the nearest backup was hours away." Captain Rodriguez nodded thoughtfully. "In military medicine, we learn that experience comes in many forms. Combat medics often develop instincts that can't be taught in medical school. But this isn't a battlefield," Dr. Harrison said, though his voice lacked its usual conviction. "No, it's not," Colonel Hayes agreed, "but the principles of good medicine remain the same. Listen to your team. Respect expertise wherever it comes from, and never let ego interfere with patient care." Sarah watched Dr. Harrison's face as the colonel's words sank in. She could see him struggling with the realization that his behavior had been called out by senior military officers. Dr. Harrison, she said quietly, I never wanted this to become a confrontation. I just wanted to be heard when I thought a patient was in danger. Sergeant Williams reached for the bedside table and pulled out another piece of paper. There's something else you should know, Doctor. My son wrote letters to several people before he died. This one was meant for you. He handed the letter to Dr. Harrison, who took it with obvious reluctance. As the doctor read, Sarah could see his expression change from defensive anger to something much more complex. What does it say? Colonel Hayes asked gently. Dr. Harrison cleared his throat, his voice unsteady. He wrote about wanting to become a medic, about how much he respected the doctors and nurses who saved lives. He paused, swallowing hard. He said he hoped that when he became a medic, he would work with doctors who valued teamwork over hierarchy. The room fell quiet except for the soft beeping of Sergeant Williams' monitors. My son died. Believing in the goodness of medical professionals, Sergeant Williams said. He believed that people like you, Dr. Harrison, became doctors because you wanted to heal people, not because you wanted power over them. Dr. Harrison folded the letter carefully, his hands shaking slightly. I became a doctor to save lives, he said quietly. Somewhere along the way, I forgot that healing is a team effort. Sarah felt her anger beginning to dissolve, replaced by something closer to sympathy. She could see that Dr. Harrison was genuinely struggling with what he had learned. Doctor, she said, we all make mistakes. What matters is how we learn from them. Colonel Hayes stepped forward. If I may make a suggestion, perhaps this situation presents an opportunity for positive change. What do you mean? Dr. Harrison asked. The partnership program we discussed could benefit from having medical professionals who understand both military and civilian approaches to patient care. It might be a chance to develop better communication protocols that could prevent future conflicts. Captain Rodriguez nodded. We've seen hospitals implement team-building programs that help break down hierarchical barriers. Everyone benefits when medical teams function more effectively. Dr. Harrison looked at Sarah for a long moment. Nurse Mitchell. Captain Mitchell, he corrected himself. I owe you an apology. My behavior has been unprofessional and potentially dangerous to patient care. Sarah was surprised by his admission. Thank you for saying that. More than that, Dr. Harrison continued, I'd like to request that you lead the development of new communication protocols for our department. Your experience in both military and civilian medicine makes you uniquely qualified. Sarah looked around the room at the faces watching her. Sergeant Williams wore an expression of quiet satisfaction, while the military officers seemed pleased with the unexpected turn of events. I appreciate the offer, Sarah said carefully, but I need to know that this isn't just about my military background. There are other nurses in this hospital who have excellent clinical judgment and deserve to be heard. You're right, Dr. Harrison admitted. This is about changing how we operate as a team, not just accommodating one person's background. Sergeant Williams smiled broadly. My son would be proud of how this turned out, he said. He believed that good people could find ways to work together when they focused on what really mattered. Colonel Hayes extended her hand to Dr. Harrison. Doctor, we'd be honored to work with St. Mary's Hospital on developing this partnership program. I think we could all learn from each other. As the military officers prepared to leave, Captain Rodriguez turned back to Sarah. Captain, the offer to join our liaison program stands, whether you choose to stay at St. Mary's or consider returning to military service. Thank you, Sarah said. I'll give it serious consideration. After the officers left, Sarah found herself alone with Sergeant Williams and Dr. Harrison. The atmosphere in the room had changed completely from when the confrontation began. Sergeant Williams, Dr. Harrison said, I'm sorry for your loss. Your son sounds like he was an exceptional young man. He was, Sergeant Williams replied, and he would have liked seeing this outcome. He believed that people could change when they understood what was at stake. Dr. Harrison turned to Sarah. I hope you'll accept my offer to lead the protocol development. I think the hospital could benefit from your leadership. Sarah thought about Private Williams' letter in her pocket, about his belief that every voice mattered. I'll accept, she said, on one condition. What's that? We include input from all levels of medical staff. Nurses, technicians, orderlies, everyone who interacts with patients. If we're going to change how we communicate, we need to hear from everyone. Dr. Harrison nodded. Agreed. When do you want to start? Sarah smiled, feeling a sense of purpose she hadn't experienced since leaving the army. How about tomorrow? 6 months later, the changes at St. Mary's Hospital were evident to everyone who worked there. The new communication protocols Sarah had developed, with input from staff at every level, had transformed the culture of the medical teams. Doctors and nurses worked together with a mutual respect that had been missing for years. Sarah stood in the hospital's conference room, looking out at a group of medical professionals from 3 different hospitals who had come to learn about their successful program. The partnership with the military base had exceeded everyone's expectations, creating a model that other medical facilities wanted to replicate. The key to our success, Sarah explained to the visiting group, wasn't just changing policies on paper. It was changing how we think about each other as medical professionals. Dr. Harrison, who now served as co-director of the program alongside Sarah, nodded from his seat in the front row. We learned that expertise comes in many forms, and that listening to different perspectives makes us all better at what we do. After the presentation, Sarah walked through the hospital corridors that had once felt like a battlefield, but now felt like home. She stopped by the ICU to check on Sergeant Williams, who had become a regular volunteer at the hospital after his recovery. "How did the presentation go?" he asked, looking up from the book he was reading to a young patient. "Very well. 3 more hospitals want to implement our program," Sarah replied, pulling up a chair beside his bed. Even though he had been discharged months ago, Sergeant Williams often returned to spend time with patients who needed company. "My son would be amazed to see what's happened here," he said with pride. "You kept your promise to make sure his death wasn't meaningless." Sarah thought about how much had changed since that terrible day when Private Williams had died. The communication protocols they had developed had already prevented several medical errors, and the atmosphere of mutual respect had improved patient satisfaction scores dramatically. "There's something I want to show you," Sergeant Williams said, reaching into his jacket pocket. He pulled out a worn envelope. "I've been carrying this around, waiting for the right moment." Sarah recognized the handwriting immediately. "Another letter from Daniel?" "The last one he wrote," Sergeant Williams said softly. He gave it to his commanding officer with instructions to deliver it only if something good came from his death. With trembling hands, Sarah opened the envelope. The letter was longer than the others, written with the careful thought of someone who knew it might be his final words. "Dear Dad," it began, "if you're reading this, it means I'm gone. But it also means that something positive has happened because of my death. I hope it means that someone learned something or that changes were made that will help other people." Sarah continued reading, her voice soft in the quiet room. "I've been thinking a lot about what it means to serve others. In the Army, we learn that every soldier matters regardless of rank. The private who spots enemy movement can save the lives of everyone in the unit. The medic who speaks up about a treatment can mean the difference between life and death." The letter went on to express Private Williams' hopes for a world where medical professionals work together with the same spirit of cooperation he had seen in the military. "I hope that if something happens to me, it will help people understand that healing is a team effort. I hope that nurses like Sarah will be valued for their knowledge and compassion, not dismissed because of their title. I hope that doctors will remember that their oath is to first do no harm, and that sometimes harm comes from not listening to the people trying to help." Sarah wiped away tears as she finished reading. "He was wise beyond his years." "He was," Sergeant Williams agreed, "and he would be proud to see how you've honored his memory." As they sat together in comfortable silence, Sarah reflected on the journey that had brought her to this moment. The shy, dismissed nurse who had been afraid to speak up had found her voice again. The wounded veteran who had hidden her past had learned to embrace it as part of her strength. Dr. Harrison appeared in the doorway, carrying a clipboard and wearing an expression of barely contained excitement. "Sarah, I just got word from the hospital board," he said. "They've approved funding for expanding the program to include mental health services for veterans. They want you to head up the new department." Sarah looked at Sergeant Williams, who was beaming with pride. "What do you think?" she asked him. "I think my son would say that this is exactly what he hoped for," Sergeant Williams replied. "Someone using their gifts to serve others, making sure that every person who needs help gets the care and respect they deserve." Sarah stood up, feeling the weight of responsibility and the lightness of purpose. "Then I accept." As she walked toward Dr. Harrison to discuss the details of the new program, Sarah heard Sergeant Williams call out behind her, Captain Mitchell, he said, using the military title with obvious respect. Thank you for showing everyone that there's no such thing as just a nurse. Sarah smiled and touched the letter in her pocket. The one Private Williams had written to her so many months ago. His words had given her the courage to find her voice, and now she would use that voice to ensure that others were heard as well. The emergency room continued its usual controlled chaos around them, but something fundamental had changed. Doctors and nurses worked side by side with mutual respect, listening to each other's insights and valuing each person's contribution to patient care. Later that evening, as Sarah finished her shift, she stopped by the memorial wall that the hospital had created to honor fallen veterans. Private Daniel Williams' picture hung there, along with a plaque that read, "In memory of those who served others, and in honor of those who continue their mission of healing." Below the plaque was a quote from his final letter. "Every voice matters when it comes to saving lives." Sarah placed her hand on the plaque and made a silent promise. She would continue to advocate for patients, to listen to her colleagues, and to ensure that the lessons learned from tragedy would prevent future losses. As she walked toward the exit, Jennifer joined her, as she had so many evenings before. "How does it feel to be the new department head?" Jennifer asked with a grin. "Scary and exciting at the same time," Sarah admitted. "But I keep thinking about what Daniel wrote, about how every person on the team matters." They walked out into the cool evening air, two nurses who had learned that their profession was about more than following orders. It was about healing, advocating, and never being afraid to speak up when lives were at stake. Behind them, the hospital continued its never-ending mission of caring for the sick and injured. But now it did so with a renewed understanding that respect, communication, and teamwork were just as important as medical knowledge in the art of healing. And somewhere, the spirit of a young soldier who had believed in the goodness of people and the power of working together watched over them all, knowing that his death had indeed led to something meaningful, something that would save lives for years to come.